All right. Well, good morning, everyone. Welcome to our final edition of Wake Up with Wildlife for 2020. We are super excited to have our own wildlife veterinarian, Dr. Jon Enyart, here today with us, and he's going to go over a few of the wonderful case studies that we've had this year and some really interesting procedures and all that good stuff, and teach you about coexisting with wildlife since that baby season is right upon us, going to come in sooner than we'll know. But just hang tight for our next year of speakers. We're rolling them out. I'm still getting our January speaker confirmed, but I'm hopefully, fingers crossed, it's going to be a speaker from the San Diego Zoo, and they are going to talk to us a little bit about some research they're doing with pronghorn sheep down in Baja. February, stay tuned for that as well. It's going to be our virtual baby shower. Unfortunately, we're probably not going to be able to have baby shower on site this year, but we still need all those donations. So we'll be sharing that wish list with all of you. So hopefully you can spread the word and help us gain some of those donations. So we're a little worried since we won't be having it on site that we might not be getting as much that we need, but we really depend on all those donations to help us survive out through the year. But we're going to have a really interesting speaker series coming up for 2021. So keep an eye on the website for that to come. And so without any further ado, Dr. Jon, I am going to hand it over to you, and I'm going to let you take it away.
Great. Thank you, Carly. Hello and good morning. I'm just going to share my screen here and get this up and going. Carly's going to tell me if I'm doing it wrong.
You got it.
We're good now?
Yep, perfect.
Okay, awesome. And Carly didn't really give much information on herself. She is a rock star with us, and she does such wonderful stuff, making sure that the community knows what we're doing and really just representing us in a great way, and wonderful job of things like this, just outreach and bringing in the gifts for the baby shower. But thank you. So we really appreciate her work with us. The work that we do and the people that we do it for is the community. So that's what this talk is primarily about. So I do want to thank everyone from taking the time from whatever sort of isolation event you had planned today, whether it was just watching more movies or cleaning out another closet. I appreciate you guys being here. And I'm really excited to present a topic that I think many of us share as a passion, which is helping animals. It's really nice to see that there's a whole bunch of people here right now. I can't actually tell how many, but many. And I'm pretty sure I've got several family members watching right now. So that's pretty cool. Hi, Mom. They're just not used to seeing me without a 3-year-old bouncing around me. And pretty sure my dad's watching too. And he's actually one of the biggest reasons that I'm here presenting this material today. He taught me at a very young age that every animal deserves our care and respect, to take action to help any animal we can that's down on his luck: a dog, a cat, an owl, or a spider. So fast forward 20 years, and that's when I made it to UC Davis Vet School with plans to be a wildlife vet. And I studied a lot. I focused mainly on wildlife medicine, graduated, and then took a little detour. And so I worked in emergency medicine for almost 10 years, really got my fill of that, long hours, long days, and a lot of work. And then I focused more on natural and holistic care, including acupuncture, before taking the position as the first staff full-time veterinarian here at Project Wildlife and the San Diego Humane Society, where I really am extremely grateful and proud to be a part of this program and organization. Also extremely grateful to my wife, Forrest, who came across the job opening and showed it to me back then. So thank you for that. So now here we are, and I'm working my dream job, and I get to come on here on a Saturday morning and chat about it. So it's great. So I'd like to just get started then. And I'll kind of talk to you a little bit more about what we're doing. And mainly it's just discussing all the things that we can do as a community and we as a group here at Project Wildlife to help our native wildlife just do better. So to start, this is just an introduction of our mission here. And as you can see, we do focus a lot on the orphaned, the injured, and the ill wildlife that come into San Diego. But where this talk is geared towards and is really just educating the members of the public. And so we can foster that understanding and respect for our native wildlife and our ecosystems here. So it's a holistic approach, which I really love. And I've, been studying a lot recently, and it really does help kind of incorporate that into our plan every day. And this happens to be the 3-year-old I spoke of, looking at some really tiny skunks with me. He's already pretty excited about all that stuff. And then to give you a little bit more of an idea of what Project Wildlife's all about, here's some history on the program. It was established in 1972, pretty much volunteer-based, and I think it started in some personal homes in North Park, excuse me. And then we moved to Sherman Street, I believe somewhere in the 90s, if I remember right. And then back in 2014, while we were still at Sherman Street, we did merge with the San Diego Humane Society. And now we have comfortably fit under the umbrella of the San Diego Humane Society as their wildlife program. So you can see actually up here, I'm going to kind of use a little pointer here. This was the original logo for the program. It has been kind of phased out since we want to kind of really be under the San Diego Humane Society. So that it's a little bit of a relic and something that we all really appreciate and love. But they recently added this sweet little hummingbird to our logo that has then kind of brought the wildlife to the logo and to the program. And the cohesion we have and the integration between all of the campuses and between the shelter and wildlife side has been really wonderful, the collaboration as well. So the Wildlife Center that was built and we moved into just last year was where I am today in my office is at the Chuck and Pilar Bahde Wildlife Center back in April of last year. And then just in September of this year, we acquired what was previously Fund for Animals Wildlife Center operated by the Humane Society of the United States, is now part of the San Diego Humane Society. And the center we work out of up there is the Ramona Wildlife Center. We do a lot more of the predator, the apex predators at that location. So the mountain lions, coyotes, bears, bobcats, even the skunks, and the larger raptors as well. There's a very nice large flight pin out there. Altogether, we're Project Wildlife, but then we have the 2 different campuses and the 2 different centers, but it's all one big program. And yeah, I'm really grateful. I actually moved in. I started when we were still at Sherman Street, which was, I'll show you here in a second, not the nicest place to work, but I loved it. And it was a little bit outdated and well, you'll see. On the left here, you can definitely see the appeal of the trailer. I spent a little time in one as a child and growing up in a trailer park. So it was nostalgic for me, but I was definitely ready to move on to the large, beautiful new Bahde Wildlife Center that we're in now. And it's really amazing. And so much of it is also just thanks to the public and those that are generous with their resources to help us out here. And we really wouldn't be able to do any of this without people. And so we are one big happy team here. This is right when we moved in. So it's a big thank you to everyone that helped us do that. And this is just our Halloween antics from last year. Hence, there's no masks. So this was pre-COVID days. Just wanted to introduce you guys a little bit, everyone, to just kind of how it operates, how this place works. And so we have 4 different, you could call them sections or departments, but really we all work together and we do it really well, I think. But intake. And so that's where a member of the public would bring an animal if they had one that was injured or ill or orphaned. And so because of COVID, we have had to move all of our intake procedures outside. So that's just a little bit different. There is a large white tent out there now and it works pretty well. There is an after hours room. So as of this point, if someone finds something, in the middle of the night and they don't know what to do with it, they can always bring it to our after hours room where there's crates and instructions on how to put the animals in their crate and turn heat pads on. And then we make sure to just go in there every morning and evaluate those animals and triage them and take care of them the best we can. At Ramona, because it is more predator focused, there is a gate, there is no after hours drop off. And so you actually have to be allowed on the property through, calling the gate. So a little bit different, but same idea and principle. Excuse me. The medical department is where every single patient comes through. And so as of last evening, around 9 p.m., I grabbed these numbers. We were at 12,599 patients on the year in San Diego. Just under 900 in Ramona, as you can see there. So we're hitting 13 to 14,000 between the 2 campuses is a lot. I don't personally examine every one of these animals. So we do have a staff that is amazing, our medical staff and our animal care staff, our intake staff, everyone, anyone who gets their hands and eyes on an animal is able to at least give an idea. And then of course our RVTs and our vet assistants and our interns are also right there, trying to examine every single animal that comes through. At this time of year, we're probably taking in 5 to 10 patients a day, whereas in middle of June, we may take in 80 to 100 patients in a day. So we will do our exam and provide any appropriate diagnostics and treatments that we see are medically indicated. And then we care for those animals within our ICU or critical holding room and our quarantine rooms as well. So if there's infectious diseases, and a really big point when it comes to wildlife rehabilitation and really animal care in general is, and animal welfare in general, is that humane euthanasia is an extremely important and valuable treatment plan. I know it doesn't sound like it sometimes, and if you're not familiar with that concept, it really can be tough to wrap your head around it, but it's a treatment, and suffering is so important to end and relieve. Our goal is, as we said in the mission, is to release these animals back into their environment so they can do the things they need to do, which is primarily having the freedoms to be able to reproduce and avoid predators and find food. So we want to make sure we can provide that for them. And we don't always know right away. Sometimes it takes some time and care, and we have to kind of sort it out and see how they're doing, whether it's based on diagnostics that we're waiting on, or just see how they respond to the treatments that we're giving. Once an animal is evaluated by medical and then they're cleared to at least go back into the rehab center, more in the animal care side, it is more of a rehabilitation area and just ongoing husbandry. And that's what the animal care team does. And they're amazing at it. They really are highly skilled, knowledgeable people back there. And we all, again, collaborate and work together on the best things for these animals. So as I said, it's the heart of the program where all the daily essential care happens. So even if an animal is not critical, it may still need medications and, observations and monitoring of its bandages or wounds. And they do a wonderful job of that. It's also where if an animal comes in is missing feathers or fur or needs to just grow a little bit more, where all our orphans go, or most of our orphans go, is back there so they can basically raise them up to be releasable. And then volunteer engagement is responsible for the communications and trainings of our volunteers, as well as any contacts for movement of animals. As I said, this program started as a volunteer-based program. And so over the last almost 50 years, many of those volunteers have stayed on and provide their expertise for us for these species groups. We have a raccoon team and a hummingbird team and a bat team. And so there's many, many teams that we have, and they're all very highly specialized in those species groups. And so we depend a lot on them out in satellite, but we also depend a lot on the volunteers that just come in and help us run this facility. So volunteer engagement is an integral part as well of what we do here. So one of our goals is to really educate the community, and it's what I'm here for today. And so with the focus being on the human-induced problems, which we can help prevent, and that really has been always, to me, a centerpiece of my practice is, there's a lot of stuff that we can't help, and we think about things like another animal, attacking another animal, and it ends up in our care. And so it's one of those where nature was happening, and we didn't really have an impact on it. But when it does come to things that we may have contributed to, I think that's really where I try to emphasize that we can do better. And right here is where I'd like to do it, which is, through Carly and her program, and really just getting the word out there on the things we can do to be better for the animals, which means better for the community and our environment. So this is a little bit of a dramatic picture, but I think it suits what we're doing. And it just means that we have to watch our step. And these are the things I'd like to go through today, just to give you an idea of the most common human-induced problems that we do come across at Project Wildlife when assessing a traumatic or a toxic injury. So again, things we can be more aware of, more caring, more conscientious. And again, our goal is to release them with full freedoms of movement, acquisition of food, predator avoidance. But if euthanasia is the only pathway, it's a good one when it happens. It really is. And again, it's hard to really grasp that, but it's an emphasis that we put on, so we don't put too much on our own shoulders. So we really are doing the best that we can for every animal. So we will get started with some of these things. So with glue traps, this is one where it really goes against everything we do. It doesn't match up with our philosophy at all. There's nothing humane about a glue trap. Well, the most common species that we see it in are going to be reptiles because they're just cruising along looking for something. Often a rodent will be caught on the glue trap and then the reptile sees it and goes for it. As you can see with this little rattlesnake right here, this little Western diamondback. I don't think he was going for anything. I think he just had it accidentally went in the wrong place that day. We typically, by the way, don't take care of rattlesnakes, not so much for permit purposes, but because we don't have enough antivenom around to treat anyone that could happen to get bit. But with this specific animal, we still do our best, and we're able to carefully remove them and then get them back out into the wild ASAP if we can. So we don't hold on to them for very long. Sometimes you'll get 2 to 3 animals in one glue trap. So if a mouse gets caught and then an owl sees that mouse on the glue trap and goes down to get it, or a lizard gets caught, and then another bird comes along and tries to get it, then we're going to end up with a couple of them on there. So that does happen occasionally. But again, not something that I would recommend for any sort of predator capture or abatement. So the other one, let's see. Yeah. As far as injuries, these songbirds, their feathers get pulled off, of course. And then these snakes, their scales get removed. With the birds, a lot of times because they're trying to get out so much and so with so much energy, they'll break a bone very easily. And same, like I mentioned, these owls and the hawks will also go after those. So. Just a few examples. I'm going to try not to, I really attempted not to do anything that was too not suitable for observing for those of the public. I think my mom might just be one of those people that doesn't want to see this stuff, but everyone else might be okay. I'll try to warn you if there's anything that I think is a little bit more concerning. These aren't bad. These animals all survived. So this crow has a whole bunch of just gunk back here. And I say glue traps, but I'm also referring a little bit to contaminants. And so that'd be like the vegetable oil and crude oil and stuff that, if we leave our pans of oil out. So our treatment goals is immediately to remove them from the trap. And what we use is a soy-based product called methyl soyate to do that. We heat it to the body temperature of the bird and then just gently put little bits of it around like on here and then slowly pull them off. And we may have to sedate or anesthetize or calm down the animal if they're really stressed out. A lot of times we'll stabilize these animals when they come in just to make sure they're okay. But when they're on a glue trap, it really is a true emergency that we have to take care of almost immediately. Once they lose those feathers, there's loss of insulation, waterproofing. I mean, that's really what they're for, is to keep them warm or cold, depending on what they need, but also to waterproof them and to help them protect them from the elements. And then we will stabilize them with warm, dark, and quiet. And so that's a mantra here. For most of our species, a large majority. And we'll give any medications that are indicated, antibiotics for infection, pain medications for injuries. And there's a chance they may need additional treatments or baths, and we'll do that if we need to. The OWCN, which is the Oil Wildlife Care Network, is where most of these fundamental protocols are produced or fine-tuned. And as I mentioned, we do deal with contaminants and we usually use a similar treatment plan as with the glue traps, but a sidebar there with, if anyone was curious, I didn't go on and on about oiled birds, but mainly because a lot of those go to SeaWorld if they're seabirds. So let's see. So what I'd like to do with each of these is present some way that we can all help. And that's the point of what we're doing here. These pictures are not from our center. These are from Wild Care up in San Rafael, but I borrowed them from their website since it was a really good demonstration of how an animal, the scrub jay, can go from stuck to a glue trap to up and eating berries. And I believe, according to their little notes on him, he was released shortly after. So we typically have a pretty optimistic outlook on these cases if we can. So, but how you can help, really just stop using the glue traps. There's many other ways that we can deal with whatever the problem is that we need them for. If you do find an animal in a glue trap, safety first, we have to realize that they are scared and frightened and maybe defensive. And so whether they're attacking, biting, scratching, whatever, just being extra careful. You would want to try to get it to us as soon as you can. So one of the campuses, whether it's San Diego or Ramona, do not attempt to remove them from the glue trap if you don't have to, unless it does seem life-threatening. You can always call us and our intake staff, if we're available, can at least try to talk you through that. The other thing that you can do, which is really neat, is just taking some paper towels or tissue or anything at all that could cover the sticky areas that the animal's not on yet, just to keep them from sticking even further. So that is something that you can do in the meantime. And then again, when you transport them, warm, dark, and quiet, and then just get them here as soon as you can, and we will see what we can do. The next slide does have some radiographs, some x-rays, actually the next few. So they are broken bones and some injuries and stuff. So if anyone's not interested in seeing that, now's the time to look away. So another human-induced problem is trauma and induced intentional trauma on these animals. And so I've just got a couple cases here that over the last couple of years that I've come across that were rather interesting. This poor coyote was probably shot in the ankle. And so I know it's hard to tell for anyone who's not familiar with looking at radiographs or x-rays, but he did have a break in his shin bone. This is his shin bone here. That healed like that. And he probably was limping around, foraging for food, just doing the best he can to survive with this bone that broke and then healed in a completely disfigured way. We knew that, and honestly, because he needs to be returned to the wild in a full functioning capacity, at least for this limb, unfortunately, he did end up being humanely euthanized. But again, that was the best thing for him. Taking the radiograph was helpful just to give us an idea of what may have happened. And we save all these just in case there's any investigations going on. But again, someone obviously just didn't want that animal on their property and ended up trying to shoo it off. And it ended up with the injury like that. So the next one over is a red-tailed hawk, which was actually a really cool case. I don't have the other view of this one, but you can see that this pellet is embedded within the marrow or the lumen of his bone here. This is his big arm bone, his humerus. The rest of the wing goes that way. You can kind of see some feathers right here that are in the x-ray too. So somehow there was a scab right here on his elbow, and he must have been shot. My guess is perching. That's often how they come in, as evidence of that they got shot while they were perching. And that went right up his elbow and right in there and was embedded in there. Other than that, he actually did really well. He went through care and was released within I think just a couple of weeks, maybe 3. So that was a success story, a really good one, and an anomaly. I mean, we've never come across a pellet that somehow made its way into the bone without fracturing the bone itself. There might be an old little entry wound here that's healed, but really impressed with how this bird did. The other one that I thought was interesting and cruel, unfortunately, but these are considered training darts or training arrows, excuse me. And the idea behind these is if you're shooting at a target in tall grass, then these little prongs would create, as you shoot, if you miss and you hit in the tall grass, these prongs would catch the grass and put the arrow up so then you could find it again. Over time, they've also modified these and people have just really used them for small game. We had a raccoon come in, an adult raccoon come in about 1.5 years ago. And there was a big, huge abscess on his rump. And then maybe about the bottom third of this piece of material here, which is the rod of the arrow, was sticking out of his skin. So we didn't know what that was. So he did get pain medications and anesthesia, and we were able to identify what it was. And it was, unfortunately, this was embedded under his skin, and the infection was just too severe for us to help him. But just another example of how these animals can be affected by our intentional trauma. The most common species that we see this with is going to be birds, raptors, which is the hawks and the falcons, corvids, crows and ravens, and then the gulls. We do see a lot of the other seabirds, but most of them will be transferred over to SeaWorld pretty quickly, but we do see a lot of this in them as well. Fractured long bones, so that'd be the humerus and the femur, so your bigger bones, your thigh bone or your big arm bone. And a lot of times mammals who are considered pests, even that coyote may have been considered a pest by some. Skunks, opossums, raccoons, they all unfortunately are at risk of being shot or injured in this way. This is kind of an interesting one for me because this pellet was probably not a big deal for the bird, but it was just right under the skin and it had a scab over it. So, we typically don't go after them if we don't have to, if there's no concerns of where it is and what it's doing in there. But this one was just an easy removal. And this bird ended up doing well, if my memory serves. A lot of times the birds are considered nuisances too, the gulls and the corvids and such. So we do have to be, more conscientious about those guys. They tend to be the ones that are making a lot of noise and people want to turn them off or mute them. Unfortunately, they do it in more abusive ways or cruel ways. Here's another one where it's an example of this bird of probably was perching and was shot through the wing. This is his the end of his wing. This is his ulna. So this is like our forearm. You can actually see right here is the leading edge of his wing, the patagium there. So that is his whole wing web right there. And when you look at birds, it's without having an x-ray, it's really difficult to know what part of them is what, but they do have almost all the same bones and joints that mammals do. They're just shaped a little differently and used a little differently. He was shot right through his ulna, which on a bird is the larger of the two. And in mammals, the radius is typically the larger, but he got shot right through there. There is a break. That pellet embedded right there in his thigh. So he was likely perching and then got shot on the outside of his wing, and then it went into his thigh right there. I was able to get that because it was right there. I believe the fracture began to heal, but unfortunately, again, he was injured for long enough. And this happens a fair amount where there's an injury and then they try to get by. They're wild animals. They're going to do everything they can to survive and get by. So while he's out there with an injured wing and not able to find food or not able to hunt correctly, he's getting skinnier and skinnier. And then that's usually when we find them, is someone sees that they're down and not able to get by. And then they come to us and they're already behind the eight ball. They're already pretty damaged. And so unfortunately, again, his body condition was pretty thin, and he ended up not making it with us. But we do see a lot of these, and I would say we do have a fair amount of ones that succeed. Oftentimes we'll see a broken bone and just tiny little bits of what you see here, this radiopaque or white pellet here. Sometimes we'll see just little tiny bits of that and we'll never find the pellet. So we just presume that's what happened. Pretty straightforward. No more shooting wild animals illegally. And that would be a good way to prevent this. And so I know that most people watching this probably aren't going to be thinking that mindset. And so, this is where it does help to have conversations with neighbors or others and people in the community, just maybe about this talk, or just kind of how you see that, yes, they are a nuisance, but we can manage them in a different way than being going after aggression and this type of a deterrent. So same as everything else, if you find an animal that seems that it's been injured from gunshot wound or another weapon, then keep it warm, dark, and quiet, and get it to us as soon as you can. We do keep a log of all these animals. Any animal that we think was injured with a pellet or anything else, or due to cruelty, then we keep a log of them just in case. I think I mentioned that before. Where if there is an investigation, we can provide any evidence that we need to. All right, another big category that we come across, especially here in San Diego, living near the water, and we do have a few lakes here, but for the most part, this is pier fishing and beach fishing. I think that this occurs. And so the more often, the common species that we see this with is the birds, especially these seabirds. And so this pelican here, he has one up in his nair, up in his nasal cavity right there. It just got probably stuck there as he was trying to remove it from somewhere else, I'll bet. So penetrating wounds, a lot of times these things will wrap around their wing or their leg. I've even seen them wrapped around the tongue because they've swallowed it. And then if there is a lead sinker, that is another concern for toxicity, and I'll get into that as well. Not to mention the pellets and the birds. So those two also bring up another concern, and I'll get into that in a little bit. Turtles, actually, typically it's hook ingestion, but we see a fair amount of them as well. And then smaller birds, and I have an example of that in a minute. It's interesting. It's often hair, and so I know that that's something we can't really manage or prevent very easily, but it typically is hair or string in those smaller guys if there is going to be a problem. We will usually stabilize them with medications and fluids, but this is another one like the glue trap, where if there's a hook in an animal and it's causing a problem, we will typically sedate them, or at least give them anesthetize or sedate them a little bit to remove the hook. Maybe take an x-ray real quick and just see if there's any internal, because one on the outside usually means there's at least one on the inside as well. And then, the prognosis always depends on the injury that happened. So we call them sequela. So if you wrap a bird's wing in string, then the longer it's on there, the more compromised the wing is. And so we see every variation of that, whether it just happened, it's loosely wrapped around, or there's something that's wrapped around so tight that you can just tell it's been on there for days and days. But we will control pain and infection while providing that supportive care. Here's two different turtles, actually. This is a pond turtle and this is a red-eared slider. These are not native here, and they are invasive species. So they do end up going as strays to the shelter if we take them in. So we don't release them back to the wild because they do carry disease, and they're invasive to the pond turtles' habitats as well. But when the shelter calls us and says, hey, can you help us get a hook out of a turtle, then we're happy to help. This pond turtle, we actually were able to retrieve as well. Unfortunately, the injuries internal that this hook had done were not survivable. So we have one really good story and kind of a sad one here, but we are capable, and we do our best to help every one of these guys. The concerns here is infection and tissue damage, which we see a fair amount of. This is a younger pigeon. You can kind of tell by the down that's still sticking out there. And he came in with a lot of hair wrapped around that foot. I did a little close up here. Surprisingly, this is as good as it's looked. And I wouldn't be surprised if this is as good as it ever looks. But I'm really happy that the toes are pink. He can use them. He can stand on them. You can see this line right here. That's where the string was wrapped around. That's all been removed. But for that blood flow and that lymphatic flow to empty from the foot, there's got to be some sort of a connection here. The fact that it is still viable, he is still using it. He's not extremely painful. He doesn't show, I mean, he's standing on it, which tells us he's not very painful on it. It's pretty encouraging. And even if this foot looks about the same, after a couple of weeks, we would likely just release him as he is. For one, he's a pigeon, and they tend to do really well. They're rather hardy when it comes to what we consider the songbirds. He is a columbid, like a dove, but they tend to do really well. So luckily he's a pigeon. And then regardless, actually here, let me jump into, so this is, there's a cormorant here. So you can actually see all these little hooks through here, a swivel. I don't think there might be a sinker on that one. So there, I believe there was on the outside. I think these were all on the outside of the bird. And so he was anesthetized, and we were just able to remove them from his toes and his wing. This one is actually internally, and I believe he ended up defecating this hook out. It's so far back there, you can see it right there. But it's really helpful for us to know whether or not these are in here. So these x-rays are super helpful. Here's one that we went after, and this is another gull, a juvenile Western gull that we went after. And so Dr. Benefiel in the foreground here, and I and Dr. Kushner, so those are the two interns that work with me. We're using what I was able to find on Amazon, which is a industrial scope for plumbing or auto mechanic work. But it works really well for what we do, and we've modified it. And so far in retrieval, we're 5 for 5. So we've gotten out pretty much everything we meant to go get out with it. And it comes in pretty handy. And again, we're a nonprofit. And so these are the types of things we need to kind of come up with and use, but it really is nice. We do worry about damage to the GI tract with these. And as I mentioned, if this last slide where, this next slide I'll go into, lead is also a big concern. And so, if we're able to get the hook out, not too much concern, we would still test for it. If we're able to get all the hooks off of them and there's none internally, we really don't worry too much about it. But whether it's a swallowed sinker or a pellet, we do worry about lead toxicity, which can cause some severe gastrointestinal and neurologic problems. This machine, we were able to use our medical equipment budget, and this is something that's used by pediatricians and in hospitals to test the lead for young babies. So we're getting pretty much the highest quality machine we can, and we're able to do this in our lab here. If we were to send a test out, it's $132, I believe, and that takes 10 business days to get back. So there's a lot of lag time in being able to treat them appropriately, as well as monitor and know that we're doing the right thing. This machine is $6 a test. And so it was a little bit of a upfront payment, but all we have to do is probably 20 tests and it pays for itself. And so we're really happy to have that. We just got it a couple months ago and we've been using it a lot. And with the two interns that are here, we'll probably end up doing a research study, or at least collaborating with another wildlife center to help do some more research on this. It is important to note that usually lead is absorbed from the gut. And so swallowing the sinkers is probably the one occurrence that it's more concerning. Whereas with the pellets, unless they swallow it, it's not as likely to leach into the bloodstream and then back into the bone. It still happens. I mean, we still have to be aware of it. One other thing about lead is it can be in, old paint from prior to I think the 80s or early 80s, maybe 75 or something, but the lead paint, as well as roadside foliage. And so a lot of the plants on the roadside, which opossums eat or squirrels eat, is loaded with lead coming out of our cars. And so that's another one. So we've been testing a lot more than we normally would. And the treatment for that is chelation therapy, meaning we give them medication that would grab the lead, bind it, and then remove it from the body. And we're doing okay with it. I mean, it's a tough one to treat because animals are usually pretty sick if they have lead toxicity. But so far, we've done a pretty good job of managing some of these cases. Another big one. Sorry, you know what? Actually, let me just real quick, the how you can help. I didn't put a slide up, but I just didn't want to point out when you're fishing, when you're working with things like fishing line, just the biggest thing there is clean them up after ourselves. And if we lose line, trying to retrieve it. And if you're walking on the beach and you see stuff like this, these are the types of things that we can just on our own be better stewards for the native wildlife and pick these things up. So another big one you'd be a little bit surprised by, but it happens more often than not. I mean, it's just often enough that it is a big concern would be the garden netting that people put up and around to keep animals out. And those animals tend to try to get into those things. Snakes very commonly are just cruising around looking for food or a new home, and they'll get caught up in it because those scales catch the netting. And so they attempt to turn around or they go back through the netting, and then they just can't do it and they get all wrapped up. And I've got a visual for that here in a second. So it does damage to their skin, their scales, a lot of constriction injuries if they've been on them for a while. And then avian species, typically it's their wings and toes, and occasionally they'll get their head stuck in there too. With bats, it's more the fake spider webbing that we've seen just a couple months ago around Halloween time. But birds as well would get stuck in the fake spider web. So I kind of lump those together since they're things that we put up outside. Here's a good example here. So I tried to do a time-lapse video with this, but I couldn't get it embedded. So I just took a screenshot of one moment of that. There's a king snake that got really wrapped up in here. And the video is pretty neat. I'll try to get into another presentation, but our vet assistant, Claudia, actually is with me and I'm holding the snake and she's able to cut it out. And it's a pretty cool time-lapse video and we just get it all off of them. Minor injuries. And we were able to treat him with just a couple medications for maybe 2 weeks and off he went back to the wild. This is a thrasher and he has, I think we had just removed this garden netting material from this foot here and he did fine after. This is another example. And as far as how you can help, I wasn't aware of this, but so on my investigating for this presentation, I did find there is some alternative nettings that would probably be much less of a concern or a risk for these animals. And so you could use those. You could make sure to check your nets daily, attempt to make them, inaccessible to animals, which is very difficult, and obviously discontinuing the use of fake spider webbing. And I had acknowledged Wildcare earlier for those pictures of the scrub jay. I want to do that again here. They put up a really cool little flyer. Sad for the screech owl that was stuck in the spider webbing, but it's a good visual on what can happen. And so they do a great job of getting that out to the community and really making sure everybody's aware of the dangers there. Another big one that's not a surprise at all is these rat traps, these rodent traps. These are vicious and they typically are snap traps. They'll grab the animal based on a trigger. Some of them like this, they might have poison inside. They might have an electrocution modification on it where it can actually zap the animal. Or often it may just trap them live, which is preferred. But if at all, we want to avoid the ones that are causing the damage. The most common species affected by this is our marsupial, the one marsupial we have here in North America, which is the Virginia opossum. And it often causes injuries to their limbs because they're just reaching out and grabbing stuff. And especially if they're younger, their mom's letting them be a little bit more independent and roam around on their own a little bit before going back to her and hopping on and running off. But that's usually, I believe, when it happens is they just kind of get curious and get caught up in these. And so I've had a fairly good success. We have been able to rehabilitate these guys. These are two different opossums. The one on the left is his left arm was caught in a trap, and this guy on the right is his right arm was caught in a trap. He was released probably 3 weeks ago, but he ended up with a radial nerve injury, which basically controls everything from your shoulder down as far as motor function. And so he could barely move that arm and place it, but after, I want to say 3 weeks, maybe 4 to 5 treatments of acupuncture, he was fully functional. This one here, I've been treating once a week, and I would say we're probably at about 60 to 70% improvement from intake. So I'm really optimistic about this one, but if he can't use that leg, then we don't want to put him back out in the wild and risk that he's going to be, preyed upon because of the injury that we allowed him to go back with. We really want him to have full function. So these are exciting cases just because it's something that we can really do for them, and it helps us battle against all those rat traps that are out there. So live traps would be ideal, and these are a couple examples of that. And then they don't get injured, and you can remove them appropriately. You can also call San Diego County Vector Control, and they'll come out and actually do a free evaluation of your home. They don't go in the home, but they'll at least walk around and kind of show you some places that you can do improvements. And most of it typically is the rats are there because you're providing something for them to live by, whether it's housing under your house, under a shed, in your garage, which I currently have a few visitors or tenants in our garage. And we're working on that right now with live traps. But really it's modifying those buildings in your home is one of the best ways that you can really improve that and help keep the rats out, because they do carry diseases, bubonic plague, hantavirus, salmonella, rat bite fever, which is a strep organism. So Vector Control will come out. There's a website there, and they'll do a free. I think for us it was maybe a week or two before they got out to us. But then someone that Project Wildlife in the past has worked with is this gentleman, Chris Jones, and he does a great job. He's actually working with us at our house right now. He and his son come out and just really they're doing the modifications, and that's helping more than anything. So I would advise absolutely getting a hold of him. He's a wonderful man and does great business. One other rodent control issue is the toxins, and so rodenticides, and that's the rat poison. The ones we're most concerned about when it comes to the animals that we see, and of course the rats themselves, because these are also inhumane, are the ones that are second generation anticoagulant rodenticides, or SGAR for short. They are ingested by the rat, and then within about 1 to 2 days, or an animal, when I was in ER, I think I saw in companion animal emergency, I think I saw probably at least 1 case of rat poison in a dog a week in the busier parts of the year. And so it's very common for our companion animals and our friends to get a hold of these things. So another reason not to have them around, aside from the fact that it actually will cause quite a bit of suffering and then kill any animal that eats enough of it. Internal hemorrhage is the primary symptom, and you may not see it outwardly, but they are going to be suffering internally, and then they end up just taking a turn for the worse. What we do is we really need to consider this when any animal comes in and they're not doing well, especially if they're pale. So we look for bruising, bleeding, and the raptors tend to be the ones that get a lot more of it, because what they do is they eat the rats that are running, slowly walking around, not able to get away. So those are the ones that are kind of easy pickings. Well, unfortunately, those may be the ones that are full of poison too. And so we do see that quite a bit. The governor, as well as the Congress, just this year passed Assembly Bill 1788, which is the California Ecosystems Protection Act. And it prohibits the use of these second generation anticoagulant rodenticides, brodifacoum, bromadiolone. So they're all like coumadin derivatives, difenicum and diphenothiolone. So that's really nice that we've passed that legislature as of August 31st. And I think then the governor signed it into law in September. So Home Depot and Lowe's and all those places can't sell this stuff anymore in California, which is wonderful for our raptors especially, but also for our dogs. This is a really cool case. Unfortunately, I'll tell you right now that this bird did not survive through care, but we continue to progress our medicine and advance everything we're doing here. I wanted to give an example of this just because, maybe 5 years ago, without a full-time staff vet and without 2 interns and a larger medical staff that's really capable and knowledgeable, we probably wouldn't have attempted this as a program. But that now that we're here and the interns are here and myself and the medical staff's highly trained, we jump on these cases right away, and we know we can help them. And so what you're seeing here is a red-tailed hawk under anesthesia receiving a blood transfusion, and it's actually in an intraosseous catheter, which means it's a catheter that's going into the end of his wrist, right around there in his ulna, and we're giving him blood through that. What you're seeing on the right here is an example of his red cell count. So the recipient, that's this bird here. We took a little bit of his blood and put it in a capillary tube, and then we put it in a centrifuge and spun it down. So the top might catch it. There's clear stops right about there, and then the red stops right about there. And on this one, you can see that there is relatively much more red blood cells in his spun down blood. So above is serum. So you'll see serum above, and then you just have their red blood cell count. So we compare them. I believe his red cell count was probably around 10%, and this animal's was probably around 60 based on how this looks. So that means that the average, the normal red-tailed hawk red blood cell percentage, that means how many red blood cells are in his bloodstream, should be around 40 to 50%, even higher. And so being at 10% told us he's very low. He's lost a lot of blood from this rodenticide, from this rat poisoning. And the donor, who is actually an ambassador red-tail that's about to be taken out to the zoo to carry on as an ambassador there, was nice enough to give us a fair amount of blood in here. And we know that that donor could afford that because he has a really good red blood cell count. So this bird didn't succumb to the rat bait. It unfortunately had a really nasty toe infection, and it was on his hallux, which is the back grabber toe, the big one that they grab with. We can't release a raptor without those. They have to have their hallux in order to grab their prey and to get nutrition and to defend themselves as well. Unfortunately, that was his fatal injury, and so we did have to euthanize. But again, we are really optimistic about the future cases because we're getting much better at what we're doing here, and we're advancing the medicine, and that's really the point, is just to make sure we're doing what we can. Another one that we see a lot, and I mean a lot, is window strikes. And I would say they make, if we were going to lump categories of cases, this is a majority. Besides orphaned animals coming in, this is probably the majority on a percentage basis of the most of anything else. These Cooper hawks and sharpshin, the small ones that are chasing birds, and so they're eating on the fly. A small songbird might come flying through here and then dip out and go a different direction. But a lot of times that Cooper's hawk doesn't see that happen and just sees more sky in front of them because it's reflective, especially here, and they smack right up against it. Songbirds as well, especially those that are chasing prey. And so any insectivores are going to also have issues with that. A lot of the seed eaters, I mean, we'll still see it just because they're flying around, either avoiding predators or just going from place to place. So the injuries that we see are head trauma. So we might see seizures, imbalance or comatose, facial injuries. And then because the head is right there with the shoulders, extremely important structures there for flight in the shoulders. And so if they hit that window hard enough, we can see multiple injuries or what we call polytrauma. And so actually, I did have a note here, up to 1 billion birds die each year in the US due to collisions with windows. And there is a research that shows that I'd say on average about 65% of the window collisions are fatal. And just based on my experience here, I would agree with that. I think that's a good percentage. It's probably a good number, at least anecdotally from my perspective, what we see. We do only see them at one moment in time, so we don't know how they're going to do. We do try to give them time. This is a Cooper's hawk, I mentioned, and by his interesting little haircut, hairdo, and his beak right here, he smacked a window pretty hard. But we can't take his initial presentation as this is how he's always going to be. I related a lot to a concussion, a really bad concussion. And sometimes they do show us right away they're not going to do well. But the beak, it'll regrow. It did regrow. But coops are tough birds, and they tend, after just 2 or 3 weeks, they tend to show us like, I'm going to be all right, if they haven't already shown us in the first couple of days that they're not. So, probably just has a really bad headache. And as long as we see improvement in them every 5 to 7 days, then we reset the clock and say, okay, you get another 5 to 7 days, because we really want to give them a chance. And neurologic injuries are some of the hardest to predict what's going to happen. And so we do our best to give them the benefit of at least a couple weeks. Seems really simple, but there's a lot of big windows out there, and many of us like our windows, and we don't want to kind of, fog them up with all kinds of stuff. But if you ever hear a bird at your window and realize that that's what's happened, I would strongly urge that we get these. Birds tend not to want to fly where there's other birds, especially if they look like this. These are nice too, because they look a little bit more frosted to us, but then the UV that comes through for the birds, they'll see real well. And you can even see they've used, it's almost like a little bingo marker where you can just dot the window all around. So if my family's watching, you might be getting these for Christmas. This is another situation for how you can help, would be, protecting your neighborhood, transient migratory birds with these decals. And another situation where you may be discussing with your neighbors, or the HOA or community can help educate them and just provide increased safety for these native birds. This is called Window Alert, if anyone's interested. These are the ones that we've actually requested for our baby shower that we have here every year at the center. So these Window Alert stickers are the ones that we're looking at, because we like them for some of our windows internally, because we do end up with some internal indoor birds loose. And so we just want to make sure to protect them as well. Those are the main categories. I really wanted to touch on those. There's many other things that I think are really important. I do have a couple just quick ones that I want to go through. Solar panels, not very frequent, but they are often fatal. You can kind of see what the solar panel can do. This hawk right here, completely singed. And it's not just that the feathers go away. Unfortunately, and with electrocution in there as well. Infrequent, it can often take fatal, but it can take days to determine, meaning that you can, if you've ever burned your finger, it hurts, but then it's like 3 or 4 days later before that blister really forms and shows you how bad that burn is. And so we end up with the same problem with solar burns and electrocution. The solar farm that's out in San Bernardino is a unique one, because it has a lot of solar panels aiming at this boiler. And I think I'm saying this right. Hopefully, if anyone's an engineer out there, they can correct me. One of my family members, maybe. But as these are pointing up at it, you also end up, they're heating these boilers. And so different than just a home solar panel, which if they land on it, they'll get burned. But this actually creates what they call a solar flux. And so if the bird just comes along here, flies through that, that can actually burn them and knock them down and kill them. So that is more of something we should probably talk to our representatives about, and something that we should reach out to them to see, is there any way that we can help prevent these solar farms from hurting birds? And they do a lot. I mean, they really try to do deterrence and things, but when it comes to in the home, there's really not anything to safeguard birds from landing on a solar panel. When you look at protecting birds from solar panels or something online, what you come across is a lot of ways that you can prevent birds from nesting under them. So really, that's just more for us than for them. And I guess it would protect them just because it keeps them away from housing near it, but it's really landing on it that's the biggest issue. So really just try not to leave live wires. If you do have solar panels, maybe putting up one of those plastic owls or something, just to kind of make sure birds stay away. And then finally, vehicular trauma is one that it's really hard for me to say other than drive better, drive more careful, drive more attentive. But what we can do as a community or as a group, and if anyone hasn't seen this yet, this is the Utah overpass that They finally got some good footage over, I think, the last few months to show. And I'm just going to play this. It's a few minutes long. I'm just going to play this and let you guys kind of see. Let me, if I can actually get this to work here. So brand new overpass, and they've got trail cam set up, so they're able to see all these animals coming through. There goes a little moose. And so this is something we could do. It does take a lot of effort and a lot of time and resources, but it is nice to know. And there are several of these around the US and in other countries as well, that are really working. There is one concern that people have, which is you're creating a bottleneck for these prey to come through. So predators may end up learning that. I mean, in that case, then they will be able to find food easier. But the concern is then that we're kind of ambushing these guys. But way better than having them cross the road. And it is a nice wide area with lots of hide spaces and stuff. So a couple little fawn. It is 3.5 minutes, but I do want to jump ahead to this really cute thing here. So here's a bobcat that's doing a little scratching post, which is really fun. So that was just in September. So they've been collecting data and footage for the last few months. There's a little raccoon, kind of younger. And then I think we just end up with this moose here. And that is pretty much everything I have for this. I can tell you, for one, happy holidays to everyone. But also, this was one of my first rat traps 2 years ago, and it was an opossum. The inside of his leg had a really bad injury, and we kept him in care for, I would say, probably 6 or 8 weeks, just letting that wound heal. I didn't show pictures of that for obvious reasons. But he was released. And so, you know, even if we do have to keep them for a while, we do it with the intention of making sure they get to go out to the wild and back to their habitat. So that is it for me. I do want to thank you all, Carly, for presenting, and everyone for being here, for taking out the last 56 minutes of your morning. I really appreciate it.
Awesome. Thank you, Dr. Jon. So we do have a few questions. I don't know if you want to stop sharing, you can, or.
Yep.
All right. So I know some of them are, I didn't want to interrupt you while you were talking, but one of them goes back to talking about the red-tailed hawk with the pellet in the marrow. Did you remove that one, or did you leave it in? Was it best just to leave that one in on that case?
Yeah, we did not remove it. We would have created more, and we also tested his lead to make sure that he didn't have a toxic level, and it was really low, and so we weren't concerned about it. It was an incidental finding, really. I mean, it may have been, like I mentioned, it may have been part of what got him down, and then that led to him coming in. But that injury alone was not going to keep him from going back out. So we decided not to basically put a hole in his bone and go after it, because there really was nowhere to grab it from. We would have to create more trauma than already occurred. Good question. I mean, it really is. And we sat there and stared at it for a while, myself and the interns, just kind of like, well, there it is. Are we sure it's in the bone? Then we take another view and turn the arm and turn the wing and take another shot and say, yep, it's really in there. Dr. Benefiel, who's one of our vet interns, presented a little bit on this case recently when she did a lead toxicity talk. So yeah, it's one of our really fun cases this year so far, just because what a lucky bird.
So interesting.
Yeah.
Someone asked, when you use the word pellet, do you mean bullet or pellet from like a pellet BB gun?
Typically the pellets are from a high power, like a high pressure BB gun or a pellet gun, but we commonly see those pellets do a lot of damage. I did have a turkey vulture picture I didn't really want to show, but he has about 10 pieces of shot, so buckshot. And so what you could see there were those little arrow-shaped pellets. You know, that was one of the pictures I showed. But with a shotgun, you'll see the tiny little round BBs, the smaller ones. And yeah, that's the difference, yeah.
Gotcha. Someone asked, what will happen to the opossum if the arm doesn't heal and it can't be released to the wild? Euthanized, question mark.
Yeah, I mean, unfortunately, we do our best to get them as strong as possible. And occasionally we'll say, you know what, that's good enough. You're 90%, you're 95%. And if it's a male, maybe she doesn't have to, males don't have to carry around the 10 babies. So is it a male? And then we test them. Can you climb? Are you able to climb well enough? Can you procure your food okay? But unfortunately, really, we do end up having to humanely euthanize the ones that we really are stuck and we don't feel like it's appropriate to send them back out there. And then from time to time, we end up having a place for them or a placement for them, like an ambassadorship. It just doesn't happen a lot. It sounds easy. It sounds fun. Carly knows it's not. And we want to save every single one of them that can't be released. But I can tell you, if we did that, we would literally have, for one, my office would be full of animals. The office next door to me would be full of animals, which there actually is one in there now. But
and that's a really good point that you make, is that just because they're non-releasable doesn't mean that they can become an ambassador. Ambassadorship is such a very specialized role for every animal that gets picked. And we want to make sure we're doing right by that animal and best for their welfare. So just because they can't be released doesn't mean they want to be in front of humans and be around humans and hear our voices and hear all the noises that are associated with us. So as much as, like Dr. Jon was mentioning, we want the best for all these animals, unfortunately, that is the best choice for a majority of them. It's a very special case animal that comes in that can actually go on the route of becoming an ambassador, just due to that stress level that can come with being in front of people. So it's a tough call, but we all try to do what's best for these lovely little animals. And then I knew this was going to come up as soon as you started talking about them. It's just a big topic across the board, but it's what's the best way to control rats and mice without harming other wildlife? So if you want to take that one, we're working on stuff too.
Yeah, and I know I saw there was another question about the Q&A about what would we do with them, because there's such a risk. For one, they're invasive. Almost all of them are invasive species. So the roof rats, the Norway rats, I mean, they're all invasive, but they are so high risk for disease that we really don't feel that it's good for the community and good for the species even to put them back out there, because they are pests and they are going to create problems. And the risk of disease is the highest one because it's zoonotic. It's kind of like why rabies vaccines are important, because even though there's not a lot of rabies and we probably won't get it, everyone's dog needs to be vaccinated because it's public health. And so same thing with the rats. It's a public health issue. And while I would love to save everyone and find homes for them, they aren't native and they are, considered pests, but at the same time, to me, that's not even it. It is the disease concern. And so often if they are one of the species that carries hantavirus or the plague, then we do end up humanely euthanizing, which again, I still feel like, and we as a group, it's our philosophy that this is the best thing for them, which I know, again, it's hard to grasp that. And even when I first started learning about wildlife medicine and years ago, it took me a little bit to kind of wrap my head around that and feel like it is the best thing, but so much has to be weighed out. And unfortunately, these are tough decisions we do make.
Right. And when it comes to rodents, like Dr. Jon was mentioning, prevention is really key. That's the biggest part about stopping rodent issues inside the house. A good majority of the reasons, like he said, are the attractants, the food, water, shelter. A lot of rodents, especially during the colder months, are coming in for the warmth. So really doing an inventory of the house, and even a mouse can fit into a hole the size of a dime. So making sure you're going around filling those holes with wire mesh, with dryer sheets, mothballs. The scents are something that you can really try to accost. So when you think of an animal that you're having issues with, you really want to try to figure out what sense they use the most. Is it hearing? Is it sight? Is it smell? And really try to go after that sense as much as possible. And if it's multiple, do that as well. The more uncomfortable you make it for that animal, the less they're going to want to be there. So if you're using different scents, if you're using different sounds of putting a radio out, if you're putting flashing lights out there that is just really bothering them, they're not going to want to stay for long. So Unfortunately, it's going to take time, it takes energy, and it might take money, but really those are the more humane ways to evict animals to leave. And that kind of goes just across the board, not just rodents, but really trying to move away from those really harmful, the glue traps, the snap traps, the poison. When it's an easy solution, it's probably not the best solution for that animal, unfortunately. Someone did ask if we can share the San Diego County Vector Control website, which I will send that out in the follow-up email, along with Chris Jones and San Diego Humane Wildlife Removal, which kind of just sparked a little note in my head. I may ask Chris Jones to do a presentation for us to see if he can offer us all some of the tips and tricks that he uses. Someone did ask, when you do the live traps, where do you release the rodents?
Yeah, and I guess that was part of the answer to that question before. If I didn't, I had that slide that says live traps. I had some other stuff on there because I really wanted to make sure everyone knew that there were options and things we could do, but I also don't want to guide anyone incorrectly. Dr. Meyer, who I meant to mention, actually, she was the contract vet for Project Wildlife for 20 years. And so she's a mentor of mine, but she was always part-time. She would come in once a week, but she basically told me the other day, we were talking about this, and she said, I do my best to live trap these guys, and then I take them out, because she's in Idlewild at her cabin during COVID. She'll take them to some place where you really aren't going to worry about them going to someone's house. But she also said, but I also wouldn't want someone releasing rats in my backyard, And so there is that balance of like, well, we don't want them near us, but we don't want to put them near other people either, And so I can't really advise on where to take them. I can tell you, to be upfront and transparent and honest, is if they come here, it is likely they'll be humanely euthanized, because that is a protocol and that is a process that we believe in, for all those reasons I mentioned, the zoonotic disease and that type. And so they're not domestic rats. They're not the hooded rats, the ones that we really, all adore. Not that they couldn't be some sort of a connection in your family like that, but really the disease and that they can carry, not just the ones I mentioned, but parasites and stuff too, it's too much of a risk.
Right. Can we give some tips on transporting ill and injured wild animals to our facility?
Yeah, I would say the most common thing we see is small little totes, the little plastic totes, I think that, shoe boxes. I think when I was a kid, my dad would usually just put it in a box and put it in the basement, and then we'd take it to the wildlife center the next day. And so that was kind of what we would do. But you warm, dark, and quiet for the time being. Overnight, you could bring it in here. I feel perfectly comfortable telling someone, if you want to just leave it in your home tonight and in the same type of a setting that we would have here, then you could also just bring it in the morning when someone's here to talk to you about it. Towels are your friend. And if it's anything at all with sharp teeth or sharp claws, then a blanket might even be better. And then just, being very, very careful and grabbing them up in that and putting them into the box that's contained and sealed. I typically don't recommend feeding if you're going to get them here to us within 12 to 24 hours, just because they're so stressed out that it may cause a problem, or it may not even help them at all. Yeah. And then the quiet part's important. Stress is something we emphasize every day, several times a day here, because a little bird looks at us and we're Godzilla to them. I mean, we really are. If you're reaching in that cage, I mean, they are consistently afraid we're about to eat them. I mean, that is going through their mind all the time. It's the reason you can't walk up to a sparrow at a tree and just touch it. They know, and they fly away. I mean, you can't even get close to them. And so when they're here and they're trapped in a box, they really feel like, this is it. Okay, I gotta go now, and that fear, that stress is enough to actually injure that animal internally. And so we are very aware of that. So it's something just to keep in mind is, if you do end up with an animal like that, as cute as they are, because we have our own trouble staying away from them and not cooing over them, we really do. But we emphasize it as, get a couple pictures, get a couple peeks at them, but then leave them alone for as long as you can.
Yeah, definitely. That's, the more you look in on them, the more stress you're causing. Do we have any information about birds and the windmills?
I don't have anything updated. I mean, I know it's an issue. It's a big issue. And I think they're always working on it and trying to do things. You mentioned deterring rodents, but the same thing, they're trying to deter the birds from coming there. I think they're just as big of an issue as the solar panels. I've never come across one that I knew for sure. I never confirmed it was a windmill injury. I've never had one. So, but as we all know, they do damage birds.
Right, and bats too. So
Yeah,
that's the
absolutely.
$1 million development idea. People, if you can come up with a way to humanely deter animals from windmills and solar panels, because we still do want that clean energy,
Right.
but a way that we can do it safely with wildlife.
Yeah.
So we had one that says, do invasive species like turtles in the presentation ever get relocated to appropriate places when healed?
No, mainly because animals, technically animals belong to the state. And so we follow California Department of Fish and Wildlife guidelines on almost everything. And if they're an invasive species, if they're truly invasive, and we know that they're damaging to our environment and other species that are native, then there's nowhere to take them. Because we can't transport them across state lines, at least not without certain permits and permissions. That's usually done with sanctuary animals and ambassadors. And so in this case, with wild animals, we also don't want to return them somewhere where we just aren't sure that they know that environment, and we might be introducing diseases that they got here to that other location. So no, and honestly, when we get a red-eared slider, it's very unlikely that was owned as a pet. However, we just by our own processes and protocols, we won't put them back out in the wild for the reasons that we don't want to perpetuate the invasiveness and the takeover. And those pond turtles deserve, just as an equal chance, but the red-eared or the sliders are really good at taking over their environment.
Right.
And
it's something we work with other facilities too, kind of like Turtle and Tortoise Society, who have kind of developed because of issues like this. So they've been super helpful in that aspect as well. And hopefully get them adopted out as a pet at some point, even though they may not be a good pet. But whatever you do, don't put your pet turtles into ponds.
Yeah, I mean, I think luckily a lot of people actually have koi ponds and stuff, and they're happy to put them in there. So I think that tends to be one of the biggest, if we do adopt them out, that tends to be where they end up going.
Someone asked, how do you distinguish first and second degree burns in birds?
Similar to mammals, there's 4 degrees of burns. There's first, second, third, and fourth degree, where fourth is just burned all the way down to the bone and the bottom tissue. So it's varied on layers of skin and layers of tissue that burns through, or at least that's damaged. And so I think you're kind of referring back to the electrocution and the solar burns and stuff. A lot of times what'll happen is an animal will come in with a burn like that, and at first it's like, oh, look, it's just bruised or red. And then within a couple of days, it declares as like a second or a third degree burn. So we can't determine right away what severity the burn is just yet. So I have to look at the definitions between first and second, but I mean, it's just a matter of levels of tissue. And so I think first is just epidermis, and then second gets down to the dermis, and then third would be down into the subcu space, and then the fourth one, like I mentioned.
Gotcha. Dana mentioned that mothballs are contradictive because of the toxins. So it's definitely something that we've taken off a lot of. If you do use mothballs, it's in a very safe manner. You make sure you're following everything that the box is saying. And I'm talking more about like the holes in the house versus being like inside the closet or touching the ground to be leached out into the ground. I'm thinking more of like the little holes that might be around the air dryer, like where your dryer goes into the house. So those are not always fixed around. So you can either put that wire mesh in, add a mothball or two, but don't leave it there. But yeah, try to use it as your best judgment.
You can also, sorry, Carly, Irish Spring soap actually is a good one. And I've read a fair amount about it, and I've got Irish Spring kind of all over my garage right now. But it is also really important to check under your hood, check in your engine compartment, because the rats tend to nest there. So there is recommendations for putting little slivers of Irish Spring kind of around inside your car engine compartment.
Especially now when people aren't driving as much at the moment. So
yeah, exactly. Yeah,
very good to check.
They do.
Someone asked, can we talk about the concerns about transporting hummingbirds?
Sure. Yeah. I mean, hummingbirds are one of the most sensitive of our patients. They really are. They're extremely hard to examine without stressing them out like crazy. And I unfortunately have had several of them succumb to the stress. I think the injury is really the initial part of that. And then just, again, being handled by, a large primate can upset them quite a bit. So when you're transporting them, I would say of all the species, this is the one where dark is probably not the most appropriate. They do need light, especially if it's during the day. It does help, and that's more for heat. But the light itself is really helpful as well. And so, in transporting them, what we normally use, and I don't have anything in front of me, but is just a small little basket, either a strawberry basket or one of the bigger ones. And I don't know, Carly, if you know how to describe those, and then we use like a bouffant surgery cap and just put it over the top. They're not strong enough to push that little cap off. So I would say like, a towel with a rubber band or something over a box would be fine, as long as there's room to breathe and a way to get you can even hold a lamp on them. And if it's a midday on the weekend and you just know you can't get over here until the next day, then as long as it's daytime, you can just put a lamp, maybe 6 inches from where they are in the cage, and that they have the heat source. And then you can use a little bit of sugar water, and there's plenty of resources online to find how to make that.
Yeah, I think time is of the essence when it comes to Hummers. Try to get them in as soon as you can.
Yeah.
Someone asked us, is the San Diego Humane Society working on getting glue traps and rodenticides banned? We do have legislators up in Sacramento, and we do add our name to certain legislation that we agree with. We don't necessarily start them ourselves, but if another organization has, we will write our names on it, as long as our CEO and everyone and our wildlife staff approve, we will. So we did add our name to that ban of the rodenticides. I don't know about glue traps. That's going to be a little bit down the way. I think a really good start is rodenticides, the second generation's being banned, but I think it's going to take a little more time to get the glue traps gone. Really trying just to help people and educate them with getting those more humane methods of deterrence using those.
Yeah, and it takes a lot. I mean, there's a group called Raptors Are the Solution. RATS is the acronym, and they were really integral in making this assembly bill pass. They were a big part of that. And so it just takes a lot to gather the evidence, have proof, and then bring that to legislation and say, hey, these glue traps are doing all these things. It's not worth it. There's too much damage going on. Unfortunately, I would say that the main reason that the rodenticides have been removed, for one, people like rats, people like Raptors Are the Solution, but also people that are with companion animals and seeing that it can affect the dogs and stuff. And so with glue traps, I think we'd have a harder time convincing legislation to ban something that's so unfortunately marketable. But I'd be happy to sign on if we could.
Yeah, owl boxes and raptor perches, another good way to use humane deterrence of getting those rodent issues under control. Mm-hmm. And then we have one last that says TBI's window of recovery is generally 2 weeks. Is that the same time frame for heat strokes, seizures, coma presented ?
Yeah, thanks, Pia. Traumatic brain injury is about 2 weeks, and that's if they go in the right direction. I mean, and I mentioned that, so they have to be showing us positive, because sometimes they don't, and when they do, it is about 2 or 3 weeks. When it's a seizure or comas, unfortunately, if they're in that severe of condition, we typically don't want them to suffer anymore, because if they're that severe, we understand that they're probably in a place that we can't provide them the resources and the support. Even if we had all the resources and support available, we just know that it's probably not going to help them. And so most often, if they're in that condition where they're comatose or seizures, that's often one of our euthanasia criteria. And so, yeah, if they come out of that, it just depends on the animal. I'm sorry, I don't have a clear-cut answer there, but it's heat stroke especially is a tough one for them to overcome. Yeah. And I can follow up on her next question there. Depends on how soon you can get them here. I mean, if you can get them here right away, I don't think you need to worry too much about fussing with, sugar water and stuff. But if it's going to be a few hours, it's a good idea to at least offer them something. And yeah. Like I said, I don't want to spout out too much information as what to do. So I would, yeah.
It's hard for those too, especially just because if people aren't doing it correctly, it can get spilled and then get on feathers and ruin feather condition. So now you're kind of dealing with another issue as well. So really time is of the essence. For anyone who's watching who's here in San Diego, please always give us a call on our hotline. If you are unable to bring the animal in, we do have humane law officers that can come out and pick up an injured animal as long as you're in our jurisdiction, which happens to be a good majority of San Diego now. One last thing that I got a text message about is just to touch base on tree trimming and when's the best time to do it. We tend to get a lot of orphan birds that we assume are tree trimmed.
Yeah, not the spring.
Don't.
I mean, everyone's got a different season, but it's typically February to April, May, you know, and so right in there, it's better to time it in the winter, really. I mean, that's what I would say.
Do it right now.
Yep. And especially for those of you that are in California, I know, back in Kansas City where a lot of my family is, it's a little different, but yeah, it's gonna be cold. But at this time of year, I think it's the best time. And then talk to your tree trimmer. Please, like, talk to them and tell them, like, hey, I saw a couple of phoebes, or I saw a hummingbird over here the other day. Can you just be really careful and watch out for that? Hummingbird nests are this big, and so you will not see them. All you're going to hear is their little peep up there, and so it's something to be really aware of.
Yeah, definitely. And yeah, my San Diegans, our hummingbirds in our barn now start nesting as early as January, sometimes in December, depending on how warm we are. So like Dr. Jon said, do your due diligence, check with your tree trimmers. Really good tree trimmers know the laws, know to stop if they see an active nest. So just do a little extra homework, and you can help out all those animals. But it doesn't look like we have any more questions coming through, but those were all great questions, and we really appreciate all of you guys spending your Saturday morning with us. Thank you so much, Dr. Jon, for putting this presentation together. It was super amazing. I always learn so much. And like I said, hopefully I'll get Chris to be a presenter for our 2021 series so we can talk about those more humane deterrents, and then just knowing that he's a resource. But thank you, everyone, for attending. Watch out for those emails coming through for our next January. It won't be on the first Saturday because that is New Year's Day. So I probably won't be able to facilitate a presentation that day, but we're going to move it to the second Saturday in January. So I believe that's the 7th. So the next Wake Up with Wildlife will be the second Saturday in January. And I'm hoping to get that presenter scheduled soon just to make sure we're all good to go with the San Diego Zoo. But we really appreciate you guys joining us this year. Thank you for being patient for us moving into a virtual platform. It's actually been really helpful. We've gotten a good turnout on all these talks, and we've gotten people from across the country now tuning in. So that's been pretty exciting. But we're also able to record them now and make them available once we're done. So that's also been super helpful. So thank you, everyone, for hanging tight with us this year. We really appreciate your continued support, and have a great December, everybody. We'll see you again in 2021. Bye, everyone.
Thanks, everyone.